Hi guys, we are back and we are continuing with anxiety disorder. I promise to also consider social anxiety disorder. So little need for emphasis about what we've done before. You can relate to other videos we've done before. You understand what is anxiety disorder and when it's not when it's a disorder and when it's not a disorder, and other criteria, general symptoms of anxiety disorders. Now we want to go straight to social anxiety disorder, SAD. Yeah, there is a social situation and there is a fear and anxiety about that social situation. It's something very simple and it's something very pervasive that we will really need to consider, because over 2% of the world population have that. Yeah, and I don't know why any emotional disorder, they always say women are having it higher. Yeah, maybe because of the amygdala structure, yes, of women. Okay, so social anxiety, according to DSM-5, right? DSM-5 TR, we look at it as a situation, anxiety or fear and anxiety, excessive fear and anxiety about social situations where individuals feel they will be judged or criticized. Yes, so they are always having this anxiety and they always endure that situation with serious avoidance, right? Trying to avoid it. And I want to make this emphasis again. When it gets to disorder is when it has resulted to several impairment to life's functionings, right? Now, that is the definition. And when we consider social anxiety, we are looking at social situations. People want to avoid it, and most times they cannot avoid it. They are afraid you ask them questions. They would rather be asking you questions immediately to be in the driving seat. Yes, and if they go to events, they would rather go and start cooking to avoid coming out and staying with their friends, right? They don't want to show their face in any way anybody will look at them. You think they are working hard, but you don't know they are avoiding social situations. They would rather stay where they are cooking and help in that. So, DSM-5 provided several criteria for diagnosing social anxiety disorder, and we are looking at situations like, okay, criteria A says that there is a markedly fear and anxiety about situations in which there is a possibility the individual is being observed or may go under scrutiny. For example, your presentation, for example, you are asked to come and meet persons, right? So that is number one. Number two, and you should remember criteria A, DSM-5 say that amongst children, right, that is not with elders but with peers, with their peer groups, that is when you can diagnose it, not when they are afraid of meeting elders, right? Now, criteria B says that the individual acts in such a way, right, in such a way that to avoid that social situation. Criteria C says the social situation often provoke anxiety. It's not a situation that you say the person is normal, right? Once you hear presentation, the blood is high, the heart starts beating, right? So the situation often provoke fear and anxiety in the individual. And criteria D, right, states that the individual or the social situation is often avoided, like the response is avoided with fear and anxiety. They want to run away, they want to keep off, they don't want to be seen in that situation. Then we have criteria E, says that the situation is persistent up to 6 weeks. Yes, 6 weeks. If it's present then it's a problem. Then it has reached that level. Yes, I think it's 6 weeks or 6 months. We'll have to consider that, and I will rephrase that in subsequent videos. 6 weeks, 6 weeks, 6 weeks or 6 months. Okay, now other criteria, that is criteria E or F now. So the situation is often blown out of proportion, is out of proportion to the situation, the kind of fear and anxiety the situation represents, or in the social-cultural context, right? So you understand that, like I said initially, both the people that do performance in the stage, right, presentation, they have anxiety, but like normal one, although some of these superstars always use beta blockers, they drink it just to remain normal. They will call them the beta blockers, or most of the like Endro, metronome, atenomine. Yes, but for this situation, they are not seeing it as normal anxiety. They have blown it, like everybody's want to criticize them. Everybody want to, everything's out of proportion to the actual fear and anxiety that should come with that socio-cultural context. Yes, that is how that one goes. And the next criteria states that the anxiety is also sufficient to cause significant impairment to social, occupational, and academic functioning. Please, I always emphasize that. Then the next criteria states that the situation or the anxiety or the symptoms are not best attributed to any symptom of any medical condition, substance or medical condition. Then the last one states that the disorder is not best explained by any other psychological disorder other than the one is trying to diagnose. So that is social anxiety in summary, and we should be looking out for that, and we will be looking at the models trying to give an explanation to the onset of social anxiety. Please remember to subscribe, like, and share. Thank you very much.